So common issues faced by people that are touched by cancer: lack of physical activity. Even with a cancer diagnosis and going through, physical activity now is diagnosed at time of diagnosis, is prescribed at time of diagnosis. Whether someone's in prevention, whether they're in treatment, whether they're outside of treatment, 150 minutes minimum per week. Well, some people aren't even at 5 minutes a day. So how can we move more, right? Without feeling guilty that they're not at that 150 minutes. Exercise has been shown to decrease at least 7 different kinds of cancer, anywhere between 40 to 60%. Physical activity is huge. So again, if you're going to be promoting physical activity, it's not about what I just talked about, the data. It's about how good you feel. It's about the social aspects of it, not to prevent cancer and to tune your body, etc. Also, minimal connection with food. So Dr. Singal and I have talked about this many times. People go to their comfort food. We're curious, what is that comfort food all around the world? Maybe in the United States, it's oatmeal. Maybe if you're Jewish, it's chicken noodle soup. Dr. Singal, yours might be, dal or whatever from India.
Or worse than that, rice and plain yogurt.
Okay. So, but how can our chefs work with people to figure out how can we take that basic oatmeal and put some nutrition in it? Now we're helping somebody, right? So again, thinking of and understanding the common issues: stress and emotional dysfunction, meditation, breath work, Tai Chi, yoga. These are all evidence-based. Sleep issues. Up to 80% of individuals in cancer treatment and beyond have sleep issues, whether it's from their surgery, whether it's from their mind going from the past to the future. I need to close my shade here so I don't have a starburst on my head. There you go. So sleep issues is a really huge impact. And I listed on LinkedIn yesterday a new research that came out of Zurich last week that sleep disturbances also have a link to cancer growth at night, which many studies have done. So just very quickly, think about their circadian rhythm. That's a clock gene, right? So you have melatonin, which cascades a lot of different events and hormones in the body. So think of a clock, right? At each hour of the clock, different processes are kicked off. And so if somebody's not sleeping at 1 o'clock here, that cascading effect of what is supposed to be happening in that body gets disrupted. And so if it gets disrupted long enough, inflammation and other things happen in the body, right? That also lead to cancer. So sleep is huge. So all people want to know is, how can I sleep better, right? They don't need to know all the scientific evidence that I just gave you. They want to know how to sleep better. People have difficulties thinking and focus. This is where your tap and clap can help too. That's coordination, right? Your Kriya from yoga, your meditation, focusing on an object, all of that has been focused on thinking and body image issue. There's 3 more. Healthy weight. Now, thanks to some of the surgeries Dr. Singal does, I have to pick on you, with maybe removing ovaries, for example, women gain weight, right? So sometimes these weight issues are not because people aren't exercising, and it's not because they're not eating well. It's a side effect of their cancer treatment. So we have to approach them in a very sensitive manner. And I've seen many people from our industry speak to people who are overweight from cancer, but approaching to them like they don't understand nutrition. But that's not the reason that they're overweight. This is a side effect or a change in their metabolism. So being a little sensitive, again, when we talk with people. We have the risk of cardiovascular disease, especially post-menopause, and hormone changes as well.